Hello everyone. Today what I'm going to talk about is my final project, 3D printing applied on healthcare and medicine, and I will introduce two kinds of applications upon the topic, which are drugs and medical equipment. For the application on drugs, I've divided into three kinds of current developments as follows. The first one is personalized drug dosing, which is basically the manufacturing of oral tablets, because it's the easiest to make, and less pain produced, and much more accurate on treating illness. Oral tablets are currently prepared via well-established processes, such as mixing, mailing, and dry and wet granulation of powdered ingredients that are formed into tablets through compression or molds. Each of these manufacturing steps are difficult, such as drug degradation and form change, possibly leading to problems with formulation or batch failures. However, this is the most approachable goals to achieve an improvement of medicine. The second one is unique dosage forms. The many used dosage forms are applied on two kinds of 3D printer, inkjet-based or inkjet powder-based machines. Investigators have further improved this technology by spraying uniform ink droplets onto a liquid film that encapsulate it, forming microparticles and nanoparticles. Such matrices can be used to deliver small hydrophobic molecules and growth factors. The third one is complex drug release profiles, which is one of the most researched uses of 3D printing. With this kind of technology, the creation of medicine will be smoother and safer. Avoid the problems faced well with traditional medicine producing process. Traditional compressed dosage forms are often made from a homogeneous mixture of active and inactive ingredients, and are thus frequently limited to a simple drug release profile. However, 3D printers can print spider onto a matrix powder bed in layers typically 200 micrometers thick, creating a barrier between the active ingredients to facilitate controlled drug release. For example, MakerBot Replicator 2X. It's a kind of 3D printing machine for implantation on bone cancer treatment, which can 3D print patient-specific biodegradable medicinal implants to more effectively cure bone infections and bone cancer. Although the research is still processing, and there's no immediate cure for these diseases, but with such 3D printer, we can cut the times to create the new medicines by several orders of magnitude. For the application on medical equipment, there are top 3 developments will be presented as follows. The first one is external wearable devices, which are completely customized and fit every kind of patient. With 3D printing technology, this sort of wearable mechanical device can be produced better. For this kind of surface device, it's just like the nature of body contact. The skin tones are limited to unbreathed skin. The contact duration is based on the healing period, which is typically 6 to 8 weeks. This puts the device contact duration to less than 30 days. The second one is clinical study devices. With 3D printing technology, you can create devices for clinical studies with low cost and quantities, especially for short-term use, since the structural integrity need is not high. It's really ideal to use, and also consumes less time to finish the treatment or development time. For devices with multiple plastic components, 3D printing offers a cost-effective way to create clinically useful parts without the cost of more than $10,000, and development time less than 4 to 8 weeks of injection mold tools. For validation or pivotal studies, where the patient study size is on the order of hundreds of patients, 3D printing offers a means to conduct the study earlier in the development process while production tools and components are still developed and ready. The third one is implant surface texture. Finally, one area that has found excellent adoption in production manufacturing is in orthopedic and dental. A key performance aspect of orthopedic implants is fixation in a bond. The fixation approach is started with cement, but over the years moved to cementless fixation by texturing the surface of the implant to create high friction and chance of bone ingrowth. In this way, true solid construct can be built on, then transition to a defined porous surface structure that benefits bone ingrowth. And the first one is Hugo project, which is a project processing for 3 years, conducted by Hugo Riveros. It's a low-cost, easy-to-produce medical equipment of 3D printable wheelchair. Its materials including plywoods, zip ties, nuts, bolts, wheels, suction and cushioning. Although we are not sure if it's possible that the components can be entirely printed, but it shows high potential to work on. The second one is pattern-proof mask, made with special material which is called Polyflex. With excellent flexibility, easy to print, holds the mask firmly in place while providing good comfort to the users. The mask itself is tough and durable, safe on skin, and users can wearing it during a commute and athletes during training, which can help users change their breathing habits to decrease stress or build sports performance. Finally, thanks for your listening.